fortifying the front lines against COVID-19. Working about 12 hours a day, 7 days a week to fight COVID-19 spread attests to a person's dedication. Helping steer billions in funding and hundreds of support staff to people fighting outbreaks around the country attests to her leadership. Peggy Honin has spent most of that time in the CDC's COVID-19 response, heading up efforts that have strengthened the nation's health departments and revamped how CDC responders collaborate with them. In early 2020, when the world was just beginning to hear about COVID-19, just like most of us, Peggy was going on with life as normal. She was planning a celebration with her extended family for her father's 80th birthday that summer. And as director of CDC's Division of Birth Defects and Infant Disorders, Peggy was preparing to give a presentation at a conference on birth defects and disabilities in Sri Lanka. Then COVID-19 began spreading in Asia and Europe. Peggy says they weren't calling this a pandemic yet, but I was getting increasingly concerned about international travel for my staff and for myself, and so I canceled the trip. Since her calendar was already blocked for Sri Lanka, Peggy volunteered to join the COVID-19 response. Almost immediately, she was asked to deploy to Northern California to lead a team at the Travis Air Force Base, where the U.S. government was opening a federal quarantine facility. Her departure was set to be in 48 hours. Peggy says, I recorded my presentation for the conference in Sri Lanka and I went home to pack. Her team's main mission at Travis was helping evacuees from the Diamond Princess cruise ship, which had been anchored off the coast of Japan with a COVID-19 outbreak on board. Peggy said they had been quarantined on the ship for about 12 days. Then they had a long flight to the United States to start a 14-day quarantine again. Peggy says many passengers were older and had medical conditions that put them at increased risk for a severe illness. Passengers were fearful of this new virus. They had spent a lot of time confined in very small spaces on the ship, and they were lonely. And some had family members who were still hospitalized with COVID-19 stuck back in Japan. The passengers' anguish deeply affected staff, and mental health professionals tended to passengers and staff. Despite the challenges, Peggy's team and health department colleagues stayed focused on slowing COVID-19's advance within the United States and on trying to buy time for the country to prepare. After wrapping up her work at Travis, Peggy then flew to Seattle to co-lead a team of 42 deployers to support a health department that was fighting outbreaks in long-term care facilities, while also rapidly learning about the spread of the virus among staff and its residents. Many patients died before the implementation of prevention measures to stop the spread of COVID-19 within these facilities. Peggy says, the gravity of the impact of COVID-19 on staff and residents in long-term care facilities became very real. There were staff members afraid to come to work, Some were working at multiple facilities just to be able to pay their bills. This unfortunate reality risked spreading infection between the facilities. After returning to Atlanta, although symptom-free, Peggy quarantined at home for 14 days in order to protect her CDC colleagues who were still going to work in the office. Rising cases of COVID-19 also began to affect her personal life. Her father's birthday celebration had been postponed indefinitely, and major holidays were celebrated on video chat. Peggy's success in building relationships with health departments in California and Washington soon paid off across the country. In Atlanta, she became deputy lead and then lead of the response's state, tribal, local, and territorial support task force, where she is the face of the response to the nation's health departments. Peggy commented that state and local health departments are the front lines and on-the-ground truth. They let us know when they're frustrated with what seems like insurmountable obstacles. We like this kind of communication because it helps us determine the next steps for our response. Response staff usually work temporarily on the response and then return to their normal duties at the CDC. To provide health departments with continuity in communicating with partners, Peggy onboarded more than 40 full-time responders to the STLT task force. Peggy, who is an epidemiologist by training, has continuously gathered information on COVID-19 spread on her own and from health departments. Her name appears notably often on CDC's scientific studies on the pandemic. She addressed key questions like decisions and policies needed for safe school reopening. Peggy also made sure that the health departments are informed of new discoveries that come from data gathered from them. This helps to improve their efforts against COVID-19 spread. Even with vaccines being given, Peggy says we cannot lower our guard. While everyone is tired of the pandemic and really wants it to be over, we need to continue distancing and wearing our masks to slow the spread as we diligently work to achieve higher vaccination rates, Peggy says.